Okay, so hip flexor, iliopsoas muscle group. So I believe Sean did something like this similar, but mostly in the standing variations. So a lot of patients, again, might not be able to tolerate the standing. If they can, also that's better for them. But in case they can't, I'm gonna show you some regression, okay? Start off obviously with lighter bands. This is about medium, so it should be okay depending on the patient. What we're gonna do is go ahead and take the bands, place it right towards midfoot, okay? And we're gonna do is work on some triple flexion. Alrighty, so we're gonna do, again, we're gonna get into a supine position. And what I also like to do is I like to really get that posterior pelvic tilt, okay? Utilizing those muscles to really stabilize the hip and get us in a nice position. So when we go ahead, we have the band. You wanna make sure you separate the band a little bit horizontally to get that resistance, that tension in there. And from there, toes up. We're gonna go ahead and pull towards our chest. Okay, you're gonna feel that right in the front where the hip flexor inserts. Okay, and then you go ahead down slow. Now, if you notice my feet are not extended out, okay, I'm not increasing the lever just yet because that will increase the level of difficulty. So I'm gonna keep it relatively close to my glutes and have the patient start there. Okay, if they can tolerate that pretty well, it's pretty easy. We can go ahead and increase the lever by extending more. And now this is going to increase not only the distance to travel, but also the tension that it requires, okay? And if you notice it, I'm holding, but you can go ahead and simply go in and out of it. What I find best is I like to really hold it at the end range to really build that tension. And again, you can do it both sides. Of course, 2 sets of 10, 3 sets of 10, depending on the tolerance and the capacity of the individual. But again, you can go here to regress it, here to progress it. But you can also do other ways too. So I don't know if Sean showed this, but you can also do dead bugs. So go ahead here. As I'm extending one leg, the other one's trying to be pulled in extension too, but I'm resisting it as I stay in hip flexion. Okay? And again, I'm keeping that posterior pelvic tilt. Alrighty? And again, keeping that tension horizontally. So those are some ways to really challenge the iliopsoas group muscle, our muscle group, and regressions and into progressions. So you have plenty of tools to give the patients, and I want you to be really smart and make sure that we're gradually progressing. Give it a shot.